that there was a problem in, there may be shortage of time and you were unable to read the scenario and ultimately you attempted it wrong. So I have just kept one or two slides, otherwise we'll be discussing a case scenario so that you are able to get the concept very clearly. Uh, the male and female pelvis, if you remember, the organs in females, they are mainly intra-abdominal organs. They are lying within the pelvis, while in females, in males, there are some of the organs, they are in the pelvis and rest are extra-abdominal organs, like testes, epididymis, vas deferens that starts from outside, while prostate gland, seminal vesicles, and ejaculatory ducts, they are inside the pelvis and urethra. In females, the organs are uterus, ovaries, fallopian tubes. All these reproductive organs, they are lying inside the pelvis. Plus, they are they are in contact with the urinary bladder as well as the posteriorly with the rectum. So, whenever a surgery is done, whenever any procedure is done, these organs are at risk. So let's begin with that scenario. I hope you have seen the laparoscopic view of the uterus, of the fallopian tubes. These are the fallopian tubes. These are ovaries. This structure, which looks like to be a fallopian tube, is actually round ligament of ovary. Okay, this is why this whitish structure is ovary. This is round ligament of ovary, and this is the fallopian tube. This might be the fimbrial end of the. So this posterior cavity, concavity, which you can see is the pouch of Douglas. That is recto-uterine pouch. What is the pouch which is present on front side? In front of the uterus, which pouch is present? Can anybody tell me? Which pouch is present in front of the uterus? Okay, that very good. This is row number 25. This is utrovesical. Better to call it utrovesical pouch. Okay, whoever is 25, it is utrovesical pouch, right? Vesico-uterine नाम सही है, लेकिन we better call it utrovesical, और posterior pouch को हम recto-uterine pouch कहते हैं, or pouch of Douglas, right? So these are the important structures which are lying on front or back of the uterine cavity or uterus, you can say. Do you remember what question was given related to the uterus as far as anatomy is concerned? Can anybody tell me the question which was given in your midterm exam? Okay, reply me. Are you awake or sleeping? I understand you have been attending classes since 8:45. This would be just 15-20 minute session. So if you are there, I mean, when you are physically present, you must be mentally present as well. Are you listening to me? Say yes or no in the chat box. Okay. Awake, but you don't remember the question. Okay, very nice. At least, yes, very good. Who is this roll number 68? Please write your name. Good to know that you are awake. Very good. Who is this roll number 68? Can you please write your name? Okay, Sana. Very good, Sana. Yes, this is what I wanted to ask. You remember that it was something related to the supports of uterus. Now, okay, can anybody tell me what is the main support for the uterus? Which structure supports the uterus? You have gone through gynae and ops module. मैं तो समझ रही थी आप मुझे stages of labor भी बता देंगे. कितनी होती हैं stages of labor? How many stages of labor are there? 3 stages. Very good. Okay. Now, can anybody tell me for how long? 31 किसी ने लिखा है, यश ने. यश, अगर 31 stages हो labor की, तो बेटा आप इस दुनिया में नहीं होते. Anyways, okay. So, how long the last stage, the third stage? Yes, I understand. Yes, this was just to wake you up, guys. मुझे मुझे अंदाजा है कि इस वक्त टाइम भी ऐसा है कि यू मे बी राइट, यू मे बी स्लीपिंग 30 minutes. Okay, it is 15 to 30 minutes. 15 minutes to 30 minutes. Very good. Excellent. Means you are listening. Now you tell me, what are the main supports? Main supports for the uterus. If I ask you to name one support, okay, broad ligament. Okay. Anyone else? Ekta replied. Very good. Okay. Any other structure which you think is the main support of the uterus? Round ligament of uterus. Okay. Very good. Very good. Cardinal ligament. Okay. Who is this roll number 10? Okay. Majority says round ligament, transverse cervical ligament, pelvic diaphragm. Okay. Excellent. So you have been replying multiple, structures. अगर कॉन्सेप्ट सबका क्लियर होता तो आपका मेजॉरिटी का एक ही मतलब आंसर आ रहा होता. सो आई कैन अंडरस्टैंड दैट देयर इज lot of knowledge gap as far as this topic is concerned. So let's begin with the case scenario. Okay, can anybody read these lines for me? चलें किससे हम पढ़ाएंगे. रोल नंबर 11. Can you please unmute roll number 11, Vakas? Okay. Yes, Ariba, please. Ariba, please read these lines.
Thank you, ma'am. A 57-year-old lady presented to us with history of something coming out of vagina since 18 months and urinary incontinence since 6 months, along with dysuria, constipation since 1 month.
Okay, very good. Thank you so much. Thank you, Ariba. This is, just a little exercise. This is the case of, I hope you can understand, this is a 57-year-old lady presented to the gynae department with history of something coming out of vagina, okay, since last 18 months. Now, on examination, there is something coming out of vagina, means it's a big lump which is coming out of the vagina. Now, what that lump could be, this is actually, what do we call it in medical terminology? What is it? Can you please write in the chat box? What is this? What do we call it? आपने cases देखे भी होंगे मेरे ख्याल में. You might have gone to the gynae ward and yes, prolapse uterus. Okay. If I ask you which degree uterine prolapse is this, what would be your reply? Very good. Third degree. Okay. This is third degree. When whole of the uterus, this is cervix, whole of the uterus is coming out of the vagina. This is called third degree uterovaginal prolapse. Now, what is the reason behind this? The question asked was like this. There was a scenario given of a female who had prolapse of the uterus or something coming out of the vagina along with urinary difficulty. Now, why there is urinary difficulty and the fecal incontinence, fecal not incontinence but constipation, you can see that this is the uterus coming out of the vagina, right? Now, these are the supports of the uterus which have come down along with the uterus. Since uterus is related anteriorly to which structure? What is this structure line? To which structure uterus is related anteriorly? Bladder. Very good. Roll number 25. Very good. This is the urinary bladder. And posteriorly, what structure is there? Posteriorly, what is rectum? Excellent. Roll number 33. Very good. So there is anteriorly urinary bladder and posteriorly there is rectum. Now, as we discussed, what was the pouch anteriorly between the bladder and the uterus? What was the pouch? Utrovesical. Excellent. And what is the pouch which is present posteriorly? Between the rectum, pouch of Douglas. Very good. So these are the two pouches. Now what happens that when uterus is dragging downwards, since there is a pouch between the anterior wall of the uterus and then it is reflected on the urinary bladder, similarly from the posterior wall of the uterus, it is reflected on the rectum. When this is coming down, what it is doing, it is dragging the posterior wall of urinary bladder along with it, plus it is pulling the anterior wall of rectum along with it. You can see this is the posterior wall of urinary bladder. Because of attachment of this pouch, it is dragging downwards. Along with the uterus, there is posterior wall of urinary bladder, and along with the uterus, there is anterior wall of the rectum. Can you all understand what I mean to say? How there is constipation and urinary difficulty. Are you getting my point? Say yes or no. When I'm asking, you must say yes or no. See, you are not in front of me, but I'm just supposing you are. So when you reply, I understand you are listening to me. Okay, good. So when the uterus is coming down, also along with these uterine, patient complains of something coming out, but patient also complains of urinary incontinence or urinary difficulty in passing urine plus constipation. Why constipation? Because the uterus is pressing on the rectum, and the female or the lady is unable to empty completely the rectum. So that's why there is all time the feeling of fullness of the rectum, and there is a urinary difficulty. So when the uterus, what can be done is, I hope you might have read this topic. आपने पढ़ा होगा ना, prolapse of uterus and then the treatment of prolapse of uterus. There are different treatments according to the degree of prolapse, right? So this is the patient with these complaints. So these are the examination points which we have discussed. There's the pink globular mass about 17 into 10 centimeter that was seen protruding out of the vaginal introitus and on palpation. There is also cystocele and rectocele. Okay, इसमें फिर per vaginal examination किया जाता है, and there is we can do per rectal examination as well to feel the wall of the rectum. So what is the diagnosis? Simply it is the uterine prolapse. Depending on the degree of prolapse, there can be cystocele as well as the rectocele. जब urinary bladder नीचे आ जाता है तो उसको हम कहते हैं cystocele, ठीक है? और जब rectum नीचे आ जाता है, rectum prolapse होता है तो उसको हम कहते हैं rectocele, right? So normally this is the position of the uterus. The uterus is as if lying or sleeping over the urinary bladder, ठीक है? यूट्रस की ये इस नॉर्मल पोजीशन कौन सी होती है यूट्रस की? प्लीज राइट डाउन इन द चैट बॉक्स व्हाट इज द नॉर्मल पोजीशन ऑफ द यूट्रस inside pelvic cavity. What is the normal position of the uterus? Can anybody tell me normal position of the uterus? Anteverted, anteflex. Very good, very good. Roll number 68. I hope you remember. हमने ये सारी चीजें फर्स्ट ईयर सेकंड ईयर में भी डिस्कस की थी. Do you remember? हमने पोजीशन ऑफ यूट्रस और फिर ये prolapse in relation to the supports of the uterus we had discussed. लेकिन ज़ाहिर टाइम से फिर आप थोड़ी ये चीजें भूल गए होंगे. So just a reinforcement. Now what is anteverted and anteflexed? Means uterus is bent on the cervix as well as bent on the vagina. So it is lying over the urinary bladder. Now what happens that when the supports of the uterus, they become weak. So now what is the major support of the uterus? Can anybody tell me what is this structure where I have kept this cursor, this red dot? What is this structure which we call as the main support or primary support of the uterus? Pelvic diaphragm. Very good. So whoever answered pelvic diaphragm in the chat box was correct. The main support of the uterus is pelvic diaphragm. But remember, this was not the option given in the question. Okay? This was not the option. The options given were only about ligaments. So only one or two students answered cardinal ligament, transverse cervical ligament, which is the correct reply. Round ligament, broad ligament, both are wrong because they are just secondary supports. So I'll be telling you how these supports are important and how they make this uterus stay above the pelvic diaphragm. So first and foremost support is the pelvic diaphragm. Now there are different degrees of the prolapse. When the first degree, when the uterus has come out of the introitus, second degree when it is at the hymen, and third degree when it is coming out, and sometimes procedentia is considered as fourth degree when whole of the uterus is coming out and it is not going back. Okay, so these are the four degree, or sometimes third degree is also considered as procedentia. Procedentia means complete uterine prolapse. Okay. So what is the cause or etiology for this prolapse? जब भी आपके पास prolapse का कोई केस आएगा, इवन आप ऑप्स के क्वेश्चंस, गायनी के क्वेश्चंस कर रहे हैं, उसमें भी आपसे प्राइमरी एंड सेकेंडरी सपोर्ट ही पूछी जाएगी. ठीक है, अपार्ट फ्रॉम ट्रीटमेंट options, you will be asked about primary and secondary supports. Now, what is the primary support? It is the pelvic diaphragm. Remember that this muscular diaphragm or partition which separates the perineum from the true pelvis above, this is the main structure which is providing a floor. Okay, इसीलिए इसको pelvic floor भी कहते हैं. ये floor भी बना रही होती है and it is also giving a strong support. This not only supports uterus, but it also supports rectum as well as urinary bladder. Okay, और आपने perineal body भी पढ़ी होगी ना. Why this prolapse is common in females? The reason is, can anybody tell me the reason? What could be the reason for this loss of support? The most common reason? Yes, Gayatri, please. Can I get the answer from Gayatri, roll number 104? Can you please tell me what is the reason that the females, most common reason for pelvic muscles weaken due to prolonged labor? Okay, very good. It's not multiparity, yes. It's not just prolonged labor. ठीक है, prolonged labor can be one of the reason, लेकिन एक ही अगर डिलीवरी हुई है और prolonged labor हुआ है, तो this may not lead to pelvic muscle weakening. It is multiparity. ठीक है, multiple births, multiple deliveries. What they cause? It causes the weakness of the pelvic floor, and weakness of pelvic floor will ultimately lead to, क्योंकि देखें फर्स्ट डिलीवरी में एपिजियोटमी हो रही है, उसमें फिर डैमेज हो रहा है पेल्विक मसल्स को, और अगर फर्स्ट डिलीवरी के बाद और सेकंड डिलीवरी के बाद फीमेल ने pelvic floor exercises नहीं की, तो muscle tone will be, muscles will become lax, and by slowly and gradually, first delivery, second, third and fourth, this will become so weak that the uterus will prolapse down. Okay, so if any female, बल्कि आप देखिए ये आपकी नॉलेज के लिए भी है कि any female who has undergone normal vaginal delivery, not cesarean section, normal vaginal delivery, she must be encouraged after delivery to practice the Kegel's exercise or pelvic floor exercises to strengthen the muscles. अगर ये muscle strengthen रहे, तो चाहे ligaments weak भी हो जाए uterus के, there will be no prolapse, because this is the primary support. I hope you get it. Plus perineal body, which is actually the part of this pelvic floor. आपको पता है कि perineal body पे सारे ये pelvic floor muscles, levator, ani जो है वो वहाँ पे attached होती है. ठीक है, तो when there is delivery without episiotomy, जैसे midwives करवाती हैं डिलीवरी, अगर proper episiotomy नहीं हुई, तो there can be tearing of the perineal body. So this damage to the pelvic floor, that is levator ani, may also be the reason for the prolapse. Even first delivery के बाद भी prolapse हो सकता है अगर episiotomy नहीं हुई और there is damage to the perineal body. ठीक है, so perineal body is the main part which is actually supporting the uterus. Now, apart from these primary supports, okay, this is what you can see is the pelvic floor. There are different parts of the pelvic floor, I hope you remember. And then there is the structure which forms the perineal body. Okay, apart from that, there are fibrous structures which are supporting the uterus. Okay, now what these fibromuscular or mechanical supports are there apart from the levator ani? These are actually the ligaments. Okay, now what are those ligaments? There are different ligaments which are supporting. Apart from these ligaments, uterine axis is also important. Normal uterine axis is anteverted, anteflexed. When anteverted, anteflexed uterine axis is there are less chances of prolapse, क्योंकि uterus का जो weight है वो urinary bladder के ऊपर, ठीक है, तो prolapse के chances कम है. अगर ये anteverted, anteflexed नहीं है, uterus vertical position में, तो whole weight of the uterus is on the vagina and cervix and the levator urinae. So that's why it is possible that there may be prolapse of the uterus, right? और retroverted में भी इतनी position नहीं होती कि most of the weight of the uterus is on the cervix and vagina. So that's why there are more chances of the prolapse in other positions other than the anteverted, anteflexed. So this is known as uterine axis, which is one of the factors for preventing the prolapse of the uterus. Then there are different ligaments: pubocervical, transverse cervical, uterosacral, round ligament. ठीक है, अब ये लिगामेंट इन सब में अगर कोई अगर क्वेश्चन आ रहा है आपका प्रोलेप्स के हवाले से, द मोस्ट strong ligament, not, we are not talking about the support, because the most important support is pelvic diaphragm. ठीक है, अगर pelvic diaphragm option नहीं है, then second is transverse cervical. ठीक है, third पे uterosacral and pubocervical ligament, fourth पे round ligament and broad ligament. ठीक है, क्योंकि broad ligament is actually what is the structure of which structure actually broad ligament comprises of? Can anybody tell me? Broad ligament actually क्या है? कौन सी structure है इसमें? Mesosalpinx is related to the, yes, these are peritoneal folds. ठीक है, peritoneal folds जब जैसे ये देखें, ये अगर fallopian tube है, ठीक है, this is the femoral end of the fallopian tube and this is fallopian tube. The broad ligament is nothing, just two-layer fold of the peritoneum. ठीक है, जो fallopian tube है उसके ऊपर broad ligament यूं पड़ा हो, ठीक, तो ये क्या है, दो layers हैं peritoneal fold के. So ये कैसे अटैच होते हैं? यहाँ से यूट्रस है, ठीक, और ये यूट्रस है और ये broad ligament है. So it is just attached on the uterus. There is no question of support being provided by the broad ligament. ठीक है, so broad ligament is just peritoneal, double layered peritoneal fold, which also makes part of the mesosalpinx, but it does not give any proper support to the uterus. The main support is transverse cervical ligament. Then the second support I told you is uterosacral, क्योंकि ये fibromuscular ligaments हैं, ठीक है, fibrous component इनमें ज्यादा है. They will be holding, यूं समझ लें कि transverse cervical ligament, this is actually mass, but just imagine this is uterus. ठीक है, transverse cervical ligament are these, the ear loops of this mass are transverse cervical ligament. अब इनका काम क्या है कि they attach, they are fibrous, they contain the fibrous or connective tissue element, they attach lateral wall of the uterus to the lateral pelvic wall. ठीक है, और ये यूं यूट्रस को होल्ड कर रहे होते हैं. ठीक है, ये यूट्रस को यूं होल्ड कर रहे होते हैं. दैट्स व्हाई दे आर स्ट्रॉन्ग एंड दे आर होल्डिंग द यूट्रस टू द लेटरल पेल्विक वॉल. तो अगर बाय चांस थोड़ी सी अगर ये पेल्विक फ्लोर वीक भी हो गया तो दिस विल होल्ड द यूट्रस इन पोजीशन. ठीक है, अच्छा, दूसरी सपोर्ट है प्यूबोसर्वाइकल. प्यूबोसर्वाइकल कहाँ पे अटैच होते हैं? प्यूबिक सिम्फाइसिस एंटीरियरली एंड टू दी, and these are pubic and these cervix of the uterus. They are attached on the cervix and they are attached on the pubic symphysis. इसी तरह posteriorly uterosacral, ठीक है, वो अटैच होता है cervix प्लस posteriorly sacrum पे. ठीक, तो यूं समझ लें कि चारों साइड से uterus is actually hanging. How it is hanging? Anteriorly pubocervical, posteriorly this is the uterosacral ligament, and laterally these are the two transverse cervical. कह लें आप इनको कार्डिनल लिगामेंट भी कहते हैं, और इनको और क्या कहते हैं? नाम आपको गायनी वालों ने बताया होगा, नाम बता दें इसका, और क्या कहते हैं इस लिगामेंट को? कार्डिनल, ट्रांसवर्स सर्वाइकल एंड ligament of Mackenrod. Very good. Yes. So it's also called roll number 10. Very good. This is ligament of the Mackenrod, right? So these are the different ligaments. So if anyone asks you what is the primary support, main support, primary supports are two. One is muscular, the other is fibrous structure. Muscular is levator ani, and that is the main support. Fibromuscular or mechanical support, ligament support is by the pubocervical, transverse cervical, uterocervical and round ligament. ठीक है, अच्छा, round ligament, where is it attached? What is the attachment for the round ligament? मैंने बाकी सब ligaments की attachment आपको बता दी. What is the attachment of round ligament? Round ligament is attached from the lateral wall of the uterus to the anyone? It's attached on the labia majora, not vagina. Okay? क्योंकि yes, labia majora. It is attached from the lateral wall of the uterus up to the labia majora. Vagina में इसलिए नहीं जाएगा because I hope you remember that this is the structure which in female crosses the inguinal ligament, inguinal canal. ठीक है? ये round ligament, it makes or keeps the uterus in anteverted, anti-flexed position. ये राउंड लिगामेंट की वजह से इसकी एक्सिस मेंटेन रहती है because this ligament pulls the uterus towards the labia majora. It crosses, it's a very long ligament. It starts from the lateral wall of the uterus, crosses the deep inguinal ring, then inguinal canal, superficial inguinal ring, and then it is attached on the labia majora. This is the counterpart in males for the spermatic cord. Okay. स्पर्मेटिक कॉर्ड मेल्स में होता है इंग्विनल लिगामेंट में, इंग्विनल कैनाल में, और फीमेल्स में राउंड लिगामेंट होता है, right? So this is just a view when we have removed the uterus. This is the cervix, and these are the ligaments which are attached anteriorly from pubic bone up to the cervix. This is pubocervical ligament. Laterally, transverse cervical ligament, and posteriorly, this is the uterosacral ligament. All these three ligaments, they hold the cervix anteriorly, posteriorly, and then laterally, so that the uterus does not fall down. And among all these, transverse cervical ligament or cardinal ligament is the most important or strong ligament. ठीक है? आपका ऑप्शन शायद transverse cervical लिखा हुआ था या cardinal लिखा हुआ था, which most of the student either did broad ligament or the round ligament. These two ligaments are not the major support for the uterus. ठीक है? So these are the ligaments. I hope you can see. This is the pubocervical ligament. This is transverse cervical ligament. और क्या importance है? Can anybody tell me the importance of transverse cervical ligament? Apart from this, any other importance of the transverse cervical ligament? Yes. Okay, I'll be discussing, right? So secondary supports कौन सी हैं? These are the peritoneal ligaments, जो बहुत soft ligaments हैं, और ये बस यूँ समझ लें नाम की support provide कर रहे हैं, ठीक है? These are actually not the support. इनके होते हुए भी prolapse हो सकता है, but they are actually attached, तो हम इसको secondary supports कह सकते हैं. Broad ligament, I told you, they are covering. This is the broad ligament, ठीक है? This is covering the fallopian tube, and then it is coming down and then covering lateral part of the uterus and anterior part of the uterus. Utrovesical fold, जो peritoneum का fold है, anterior pouch and posterior pouch or rectouterine fold of peritoneum. These two folds plus broad ligament, these are actually peritoneal coverings which are covering the uterus from anteriorly, laterally, and posteriorly, and providing the secondary support. I hope you are clear about it. Primary and secondary support, and which one is the most important support of the uterus. Is there any confusion in this? Okay, so I hope you are clear, right? So let me tell the importance of, my question was that what is the importance of the lateral cervical ligament? I hope you might have gone through the hysterectomy. ठीक है? Hysterectomy कौन से दो रूट्स होते हैं? कॉमन हम कैसे करते हैं hysterectomy? ये सारी चीजें हम आपसे फर्स्ट ईयर सेकेंड ईयर में भी डिस्कस कर रहे होते थे, लेकिन क्योंकि आपने क्लिनिकल साइड अटेंड नहीं की होती थी तो आपको शायद समझ नहीं आती थी. So can you tell me what are the ways by which we can perform hysterectomy? Yes, transabdominal, transvaginal, okay, and transabdominal can be open or laparoscopic. ठीक है, आजकल laparoscopic बहुत किया जाता है, but transvaginal. So transvaginal हम तब करते हैं जब उसकी साइज छोटी होती है, राइट? तो वीक्स के हिसाब से देखते हैं कि अगर इतनी वीक साइज है यूट्रस की, देन वी कैन गो फॉर ट्रांसवेजाइनल, ठीक है? अदरवाइज अगर लार्जर है, जैसे बहुत बड़ा फाइब्रॉइड है और हमें हिस्टेरेक्टमी करनी है, तो वी कैन नॉट गो थ्रू दी ट्रांसवेजाइनल रूट. सिमिलरली मेलिग्नेंसी के लिए हम ट्रांसवेजाइनल रूट अवॉइड करते हैं, वी गो थ्रू दी abdomen. So anyways, this is the so what we do is, which important structure is ligated during hysterectomy? Which important structure is ligated during hysterectomy? जब हम यूट्रस निकाल रहे होते हैं, तो इट डिपेंड्स ऑन के वी आर डूइंग ओनली हिस्टेरेक्टमी और वी आर डूइंग हिस्टेरेक्टमी प्लस सैल्पिंगोफोरेक्टमी, ठीक है? अगर हमें फेलोपियन ट्यूब और ओवरीज को बचाना होता है, तो वी ligate the fallopian tube, we separate the broad ligament, okay, and we divide the ligaments anteriorly, posteriorly, laterally. अच्छा, laterally हम जब ये ligament divide कर रहे होते हैं, that is the transverse cervical ligament. Actually हम यहाँ पे uterine artery को ligate कर रहे होते हैं, जो यहाँ से enter हो रही होती है into the broad ligament. Uterine artery enters through transverse cervical ligament and then travels in the broad ligament to supply the uterus. What important structure should be saved while ligating the uterine artery? Okay, this is the important structure. See how much close this ureter is crossing the transverse cervical ligament and the uterine artery. Uterine artery यूं जा रही है और ये ureter नीचे जा रहा है, यहाँ पे ओपन होगा ट्राइगोन पे into the urinary bladder, ठीक है? अगर ये आर्टरी फोर्सेप्स थोड़ी सी हमने लेटरली लगा दी, तो ये यूरेटर ब्लॉक हो जाएगा, ठीक है? और अगर क्योंकि हमें बायलेटरल ये यूट्राइन आर्टरी लाइगेट करनी होती है, तो अगर दोनों यूरेटर हमसे डैमेज हो गए, तो अ फीमेल कैन गो इन अक्यूट रीनल शटडाउन, ठीक है? So this is the most important structure which is to be saved during hysterectomy. So cardinal ligament, it is one of the major support for the uterus after pelvic diaphragm, and it contains uterine artery. While ligating the uterine vessels, we must take care of the ureter. I hope this is clear. Thank you.